Urinary incontinence is a common problem. Though it is popularly believed that it affects the women only, that is not true. Even the male persons, the boys, the girls, even few children also suffer from this problem, and it is really very troublesome, and it should be treated very quickly. It should be managed. Now, when I say incontinence, it means there is a leakage of urine, involuntary leakage of urine. So that can be continuous, or that can be transitory also. At times, the woman, she cannot resist her urge, and she is forced to visit toilet very frequently. Or at times an old man is forced to visit the toilet maybe twice or thrice in the night time. So all these things are very risky for the persons, for an old patient. These things may lead to some graver problems, like old person may fall and he may sustain a fracture. That is very important. And of course it's a matter of embarrassment for women of all age. Now there are various causes of this incontinence, that a person cannot hold the urine, but there is one entity which is called overactive bladder. In medical practice it's called overactive bladder, and as the name implies, we can understand that the bladder is acting very smart. So bladder, either it contracts more frequently or it contracts at a time when it should not, because we all know that if the bladder contracts, the voiding becomes imminent. Now the bladder has got two functions, urinary bladder. Number one, the storage, it stores the urine, and number two, it expels the urine. So when the person stores the urine, at that time the person is not expected to void. But if the urinary bladder is diseased, like I said, overactive bladder, in that case the person becomes very helpless, and at times he got to visit the toilet very frequently, or he is forced to visit the toilet urgently, postponing every work. So it can lead to lots of lifestyle problem. So, and the persons who are involved in very important jobs, they should be very keen to get it controlled by proper treatment. But before I really come to proper treatment, what I want to mean that there is something what's called lifestyle modification which can help the persons. Number one, the cleanliness, avoiding constipation, avoiding tobacco, and avoiding huge consumption of fluid during the night time. So these things are very important, and it can help the incontinence or a frequency. There are lots of medications also for that, and it does help even in women, or at times in case of children. There are all medicines, but truly speaking, what I personally believe that you shouldn't go for medicine first. You should restrict your food intake, reduce your weight, and these things might help. At times there are various other causes for incontinence, like if there is the patient cannot void properly and urine gets accumulated. There is a time comes when the bladder is absolutely full, and then it becomes a real problem in the sense that the bladder cannot hold the urine, and in that case the urine leaks because huge pressure and the person cannot control it. It's called, in medical terms, called overflow incontinence. So in that case the person should be very careful, and like time voiding at frequent intervals. The patient when goes, he should voiding twice or thrice. In medical terms it's called double voiding. These are all behavioral modifications which may help a person for all these types of overflow incontinence. At times there is a continuous leakage because of some fistula. The fistula, by the way, is an abnormal communication between the urinary bladder and the genital tract, especially in female, what I want to say, or even so. That can cause a continuous incontinence, and truly speaking, these things are not amenable to medications, and the lady concerned should subject herself for surgery. It should be corrected, the defect. This abnormal communication should be closed by surgery. So these are the definite treatments for incontinence. Now, the only message what I'd like to convey that don't feel ashamed of it, because it might lead to bigger problems. And if it is detected at the right time, if you come out of your closet and if you subject yourself for necessary investigations, the actual cause of this incontinence may be diagnosed. And don't feel afraid, don't feel ashamed. There are medications which may help you. So on this Incontinence Week, this is the message I would like to convey, that all the persons who are suffering from this kind of problem shouldn't feel bad about it, because most of the cases are amenable to treatment. Okay, happy treatment for all of you. Thank you.